Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Energize and Protect Your Skin, advice from Ms. Christine Petti, MD, Plastic Surgery. Before we begin, if this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational workshops are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, I'll introduce our workshop speaker, Dr. Christine Petti, is a diplomat of the American Board of Plastic Surgery practicing in the South Bay. Her clinical research using smart lipo, cellulase, and sculpture is published globally in plastic surgery and laser journals. She's a media expert appearing on many programs such as The Doctors, ABC 2020, and NBC Inside Edition. She has also been a physician advisory board member since 1990. Thank you so much, Dr. Petti, for being here with us today.
Good afternoon, everyone. I'm Christine Petti, and I'm a board-certified plastic surgeon. I've been practicing here in the South Bay since 1990. And I'm happy to share with you today some of my experience. I started my practice here and did a lot of breast reconstruction. And it was actually breast reconstructive surgery that inspired me to become a plastic surgeon, because instead of taking things off the body, I loved creating things. The other area of my interest has always been energy-based devices, actually since the 90s. So lasers were developed in the 90s after I trained, but I went and sought additional training, and I've incorporated a lot of energy-based devices. So when I say EBD, or if you see that, it's going to be talking about light therapy, radio frequency, lasers, okay? And that's what we're going to focus on today. I think you'll find it quite interesting. So I am a board certified plastic surgeon. And again, I am a member of the American Society of Plastic Surgery and the American Board of Plastic Surgery. I want to actually thank the cancer support community of the South Bay and Long Beach for inviting me to speak to you today. It's an honor. I have to tell you that having been here since 1990, affiliated with the Physicians Advisory Board, a member of that board, I have been surrounded by stars. And I think this is a very amazing organization, and our community is very lucky to have them because they provide medical and support services that are free to our community for people that are, under the treatment of oncological diseases. So we're going to focus on, my interest, which is the skin. And as you know, the skin is the largest organ in the body, and we take it for granted, I think. So I think you're going to find this very interesting as to how not only using potions and lotions, which we're kind of used to doing that, hopefully daily, and sunscreens, but also there are a lot of energy-based devices that can be used to improve the skin. Now, I know some of you may be under treatment and maybe not be candidates at this time, but I mean, it's amazing how many medications do affect the skin. So I think that it's good for you to have a knowledge of what's out there. And I think what I'm going to talk about today is probably the most contemporary therapies used either in isolation or in combination. So as I said, we're going to talk about light-based therapy, laser, which is concentrated light therapy, and then radio frequency, which is basically electrical energy that's converted to heat. But most of the therapies that we offer patients for the skin really are based on heat. So remember that. So this is a look good, feel good lecture, and I hope you enjoy it. So first, let's talk about our learning objectives. I have an interest in CO2 laser resurfacing because that was the first laser I bought in the 1990s. And it was very expensive. And I had to go learn how to use this because it was something that wasn't actually in my residency program at all. You know, lasers didn't exist. I was trained in the late 1980s. So I was very fascinated because I went to a conference, and it was a Harvard-based conference, and they were talking about all these laser therapies and how you could use lasers on the skin surface. And I mean, as a surgeon, we're taught to go inside, right? We make incisions, we use knives, we use scissors, we use cautery, but laser is something that you kind of run on the surface of the skin. So I was like, whoa, this is amazing, because you can actually move the skin, say like for a facelift or even a tummy tuck, but you may have, like, you know, stretch marks, or you may have loose skin, and you could run these devices, you know, on the surface of the skin and tighten them and smooth and correct acne scars, you know? So, I mean, I just felt that that was something that was super complementary to the surgical part. And I felt that, especially like in rejuvenating the face, especially, you know, you can move everything and make it look young, but then you have the forehead and the nose and the mouth. That's not really treated by a face and neck lift. So if you run the laser at the end of the surgery, it harmonizes the face and makes someone look extremely natural. Okay. So it's a balanced look. So we're going to discuss not only the CO2 laser, but the radio frequency microneedling. And the thing about microneedling that's nice is that the needle that I use a Vivace device for the microneedling, and I use what's called the Cool Peel and Tetra for my CO2 laser surfacing. If I'm presenting scientifically, I can't use those brand names, but you know, we're in not a scientific environment, so I will say what I use. In terms of the radiofrequency microneedling, the needles, there's like 36 needles. They basically are robotically controlled. So when I press the button, I can set a depth, and then the needle is only hot at the tip. So what's great about the microneedling and how it complements the CO2 laser is that the needle goes in the skin, treats the dermis deep, and then comes out because it's only hot at the tip. So you can like have these treatments done, and you have like no downtime because you're not going to peel. The CO2 laser is a laser that it's computerized graphic generator. So what it does is it actually scans the skin and it's on the surface, and then your skin will peel off. But I'll show you how we have come a long way, baby, from the first CO2 that I used to what I use now. It is amazing. And so a lot of these devices, you know, it's worth incorporating them into your practice, you know, because they do things that other things can't do. So I also will focus a lot on combining these two. So they can be used simultaneously. You can have a CO2 alone, you can have a microneedling alone, you can do them together at the same time, because that, like I said, think of the epidermis and dermis, that the skin contains two layers. The epidermis you can regenerate, right? So if you get like a 1st-degree sunburn, it kind of blisters and your skin comes off, but you're able to heal that, right? But if you start getting into the dermis, which is the area where all the collagen, elastin, you know, hyaluronic acid, blood vessels, glands, sweat glands, oil glands, hair follicles, that's all the, you know, the important architectural support of the skin. So if we want to treat that, you can use the needling for that, because the laser, sometimes if you try to get down deep with the laser and heat the surface, perhaps it's going to be too rough on the surface and burn, you know. So it's a good balance to use both of these. So now we're going to kind of go back. Now, I think, again, like, it's nice, even though you might not be interested in this, you're not going to like these pictures that are coming up, but you have to look at the past and see where we've come. It's always good to learn from history, right? So the CO2 laser, it is the gold standard for skin rejuvenation. And people say, you know, what's the best for treating wrinkles? It's the CO2 laser. What's the best topical? I'll ask you that. And, you know, and you can go across the board with plastic surgeons, it's Retin-A, you know, so there's things that have held the test of time. And like I said, the technology is getting better. So I'm going to be talking about what's called the high peak power. That's the Cool Peel and the Tetra. That's what I use for the CO2 laser surfacing. And these have revolutionized the patient experience and outcome because they've been modernized. And we'll talk about some of the technical parts. They have been re-engineered so that there's much less downtime. And that's really what meets, like, the goals of our society, because everything's click, click, click. So people come in and they're like, oh, I'm going to be bruised. Oh, I'm going to be swollen. Oh, it's going to take me a while to peel the skin. And everybody wants it really fast. So, there is basically a motivation, to have and develop the techniques so that they have minimal downtime, right? And minimal side effects too, swelling, bruising, right? So, the CO2 laser is based on the concept of photothermolysis, which that just means photos are light and thermolysis is energy, right? That's heat. So we're going to apply heat to the skin. And guess what? What is our skin mostly made of? Water. And so when you heat the water, you actually then get, an injury to the skin, but it's a controlled injury. So you can control the production of collagen and the generation of new skin cells if you stay within certain ranges that are safe, right? And not damage the skin. So remember that we're trying to vaporize the tissue. That's by heating the water in the dermis and epidermis. There's certain degrees, that we want to reach so we get the proper response in terms of our outcomes, which is wrinkle reduction, smoothing, having the pigment, lighten. And we're going to cause what we call tissue ablation. So we are going to ablate means destroy, like we're going to destroy some of the cells, but in doing that, we actually incite the skin to form new cells. Okay, so that rejuvenates the skin. And there's many, many, publications that can support this. So we want not only thermocoagulation of the dermis, which incites new skin cells, but we also want remodeling of collagen and elastin, and re-epithelialization just means we're forming new skin cells. So here's a patient that I did. This was the 1990s, and it's pretty impressive. I was amazed at how well the wrinkles were treated. I did do her eyelids surgically, but I did her upper eyelids, and then you can see that, I did the laser on the skin. So it was, the forehead, the cheeks, the nose, and around the mouth. But this is what she looked like the next day, so it was so labor intensive. I mean, they look like burn patients. And so many patients, they love the outcome. Let's go back because I don't want you to stare at that forever. But the thing is that, there was a lot of downtime. And my nurse and I would see these patients in the office 2 or 3 times a week because they would be weeping and they'd be swollen. And we had to make sure that they were putting, the proper ointments on to heal, not getting infection, putting them on antibiotics and antivirals, blah, 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 So they had great results, but, it was at a risk. And, basically it was painful. Like I said, labor intensive. The patient had to hide out for weeks and they had to avoid the sun for months. And this is when they started peeling. It was like half and half. So what are you going to do? I mean, this is not a good thing to look at, right? And it was not good for the patient to go through, but we carried them through it. Like I was very much hands-on. And then you could also have problems because if that laser was too powerful, the heat was too powerful, you kind of cross the line and you would get textural changes. Perhaps the skin looked stiff or it was depigmented, it looked whiter. You've probably seen people that have bad laser or deep laser or pigmentation, either too much pigmentation, brown, or they could have also depigmentation, which we call hypopigmentation or whitening of the skin. And also scarring. So, and then the lasers in the 90s got into the hands of people that really were not trained with the skin, and in the face and the neck and so forth. So, it really went into disfavor, the CO2 laser surfacing. But, like all things, there's all those bioengineers and they work hard, and God bless them because they develop new techniques that allow us to take a good treatment like the CO2 laser and make it more favorable, easier to deliver, safer. So in about 2004, they came out with what's called fractional laser. So you hear the word fractional. That just means that, okay, so the laser lays down a little pattern, you'll see it later, but then it has little dots. The modern lasers are dotted. So you're not going to have that sheet effect like this. You're going to have sheets of skin because this was a blade of it. The whole pattern, it was heated, the whole thing. So it came off like a sheet. But imagine that you have these little micro dots. See, so like this is showing the beam going down, and then you see that red beam going down, hitting the skin in like little dot patterns, but leaving skip areas. So that's why it's called fractional, because only a fraction of that is treated. The area that's not treated can regenerate skin. So you got faster healing. And also then what happened is, so in addition to developing this fractional pattern, which you can see here, the concept is the red is the heat, the yellow is the non-treated area, and then the black is the lines, the vector lines, we call them, is where the cells like migrate into the area of injury and they heal it. Okay. And then you can see like, you know, the old laser on your left will be like what it looked like on the skin, you know, so you saw these little dots and so forth, but still, you know, we could get a little better. Okay, because the heat was high and we weren't able to control the timing of the energy as well. So this is like the second generation, but you can still see that, you know, it was a line pattern. So it was boom, 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 boom. So when you try to like line it up, like I would put a stamp and another stamp, you know, you could overlap and you would get lines of demarcation. We call that in surgery and in laser medicine. But, you know, like it was an overlap, then you would see like an extra line there and it could pigment. So you can just see the patterns on her face, okay, because it was lined, all right? So the third generation of lasers come by. This is her result, though. You'll see this is with the second generation in 2008. Her before, she's 47 years old. She's born in Southern California, you know, has a lot of sun damage, freckles. That's her at 24 hours. Still, there's the swellings there, the line patterns, the lines of demarcation and swelling and oozing. But at a month, she looks great. But still, you know, it's really not acceptable in our modern day medical requirements. So next came the third generation of lasers, which were developed in Italy. And so the Italians happen to be very good at developing lasers. And there's a big centers in Milan where they, you know, have the bioengineers that make all these new modern lasers. This is a patient who is the same age, born in Southern California. You know, she's got the Caucasian skin, a lot of sun damage. She was she worked, not worked, but played beach volleyball. And I did the CO2 on her using the fractional technique, but it was called the cool peel. And what that does is it delivers very high energy, fast, like a lightning bolt. So the shorter the pulse is on the skin, that means it's really fast instead of then what happens is, you know, you don't get as much swelling, all right, and you don't get the downtime. You don't get, it's dry. This is a dry peel. That last one, you can see she's kind of wet in the middle picture and serous. This is completely dry. So that's 24 hours. She sent me a selfie and this is her at 1 month. So it's a very similar patient, skin type, you know, age, everything. So you can see the difference now in the modern day CO2 laser. So what is, you know, what does this allow us to do? Well, we can customize, you know, I can basically customize the treatment to the patient. I can say to her or him, you know, like, how much downtime do you want? So I can change the settings. Or they say, well, I have a week, you know, maybe I can go a little up on the settings so that, you know, they have a little deeper peel, but they'll have a little more downtime. But if it's fast and they say, well, you know, I have somewhere to go in like 2 or 3 days, then I can decrease the energy. So we can kind of tailor it. I can tailor the days of downtime, the depth of the peel, the amount of correction. And, you know, again, the expectations of the patient has to be tailored too, because if they say, well, I only have like 2 or 3 days, then they may not get as good a result, but, you know, this can all be repeated. So it's very important that the patient like here, and that I tell the patient, of course, informed consent, that, you know, what their expectations are so that they're not disappointed, right? So what did the Italians do? Well, what they did is they changed the pattern, the way that the laser energy is delivered, to what's called a spray pattern. So instead of drawing the lines, it's delivered random. So it's like fireworks going off. And then it's just all over. You'll see it. And the other thing that they did was that when there's a box in the laser that generates the heat, and it was made where the heat was generated was made of glass. So glass can crack. So there was only like certain temperatures, you know, that they could get to, but then they changed it to a metal box. They could go to higher energies and then deliver this energy very fast. And that's really what the cool peel is. So you have, again, it permits high power, the metal box, minimal dwell time, minimal downtime, but you still achieve the smoothing and the tightening of the skin that you saw with the other more aggressive CO2 lasers. So this is going to show the spray mode. So it lowers the heat. Like the patient, honestly, I've had both of these over the years, you know, the old-fashioned linear, and then this, I don't even feel this. I mean, it's so random. It kind of scrambles your brain. So if somebody were to go like this and write on you like this, you would feel it. But if they go, you almost don't feel it. So the brain doesn't perceive pain. And it's also, when I go from one stamp to the next, there's no lining up, you know, it's not lined. So it doesn't, there's no problems with demarcation, lines of demarcation, like where one ends and the next begins. So the recovery is much easier. It's still the fractional laser because you're treating a fraction of it. So let me show you this. Do you see how it's coming out very random? Yeah. And she's very comfortable. I mean, she's not even flinching. You know, this is just with topical anesthesia. Now, the laser, as far as skin types, just so you know, I'm not going to use them. There is a classification of skin types, you know, according to how much kind of pigment you have. And so the more pigmented patients, it may be a little bit more risky to do the CO2. The cool pill actually is very good, even on like some of the more pigmented patients. You'll see, I'm going to show you befores and afters, but also you can use the microneedling. So microneedling is kind of colorblind. So it can be used on patients that have dark skin, you know, so African Americans and patients that have darker skin types can have the microneedling, you know, without reservation. But the CO2, you have to be a little careful as you get to the darker skin types, so you understand that. Now, here's a patient who had, I just wanted to show you the spray mode kind of close up. So like what I do is when the patient's lying down and I start the treatment, I actually take a mirror and I go, look, watch this. And I let them see. So they're not afraid. I'm not sitting there for like 45 minutes and I'm buzzing their face and they're like, what am I going to look like? I mean, I think it's really important to like let people see what's happening to them. You know, they're awake. I don't want them to be scared. I want them to be excited. So you can see she's very excited and she's done. And we did even platelet-rich plasma on her after, which a lot of the patients I will combine. You know, I'm sure that a lot of you know that platelet-rich plasma can help, you know, the healing process that has a lot of epidermal growth factors. So we'll draw the blood. You're the nurse. We draw the blood and then we spin it down. And then we just have the serum, and then we have a special kit. We can activate that serum so the platelets are much more active. And then we put that on the skin, and the skin is treated with you. Like there's no chance that you're going to have an allergic reaction. So this is something that I think is really, really important to combine. This is the microneedling. So here you can see the microneedling, right? And the needles are being embedded in robotically. And this can be combined where you do the microneedling first and then you do the laser on top. So we're going to get to some clinical results. I'm going to show you because I'm running out of time. I love this stuff too much, but you want to see the befores and afters. This is a patient who had the laser and you can see, I'll just show you befores and afters so you can see the result. This is one treatment and look around her eyes, around her mouth. There's no fillers. Okay. And then this is another one. This is the one that had the really bad sun damage, but look at the cheeks around the eyes and This is the combination. Now, what I did in her was I did the microneedling first, and then I did the CO2 on top. This is a male patient. He was all over Southern California for acne scars. I mean, he had a million different treatments. He ran into a previous nurse of mine that's now in San Diego, and she's like, you got to see Dr. Petti. So this is him having the laser after having the microneedling. And there he is. You can see after microneedling on the left, and on the right, it's after the laser. But you see, like, I mean, you safely combine these. There's a little erythema, and this is his result from the treatment. Acne. This is another young girl. This is an attorney's daughter, so it was kind of woo. But I did the microneedling and the laser. Same. This is one treatment. I don't know. Like they say, sometimes it's better to be lucky than be good. But that was good and lucky, I think, because she did great. This is another patient that comes in regularly. Now this, and you say, how often should I do this? I mean, I'm sorry, but I mean, it's kind of for life. I'm not trying to sell myself. You can go anywhere, you know, and seek out these treatments, but I'm telling you, I really believe they're maintenance and that they're better than, you're going to use skin creams. Okay. You're going to use the lotions and potions, but this is so great. Look at this. By the way, she gets Botox, but she never has had a filler ever.
Can you describe the difference between the two procedures?
I'll tell you in a second when the question. This is a patient who had a thread lift, and look, she had that little dimple here. So the thread kind of, and I didn't know what was going to happen because I hadn't seen that before, but I did a lot of, you know, passes with the microneedling first, followed by, and look at this, it corrected it. This is a patient who's African-American, and look at her. I mean, she's on the lighter side, but I safely used both the microneedling. Yeah, and she's around my, you know, she's around my age. She looks great. And this, she didn't have surgery. This is another one. You know, she's kind of the Italian skin type, Mediterranean skin type, I should say. And look how it corrected even the pigment. And then this is a patient who is of Filipino descent. Isn't that great? Just, I mean, she's like in her like early 40s. So this is an older patient. She's getting ready for her son's, you know, wedding. And she's like, just freshen me up, Dr. Petti. So that's what I did. You know, it's hard to treat wrinkles that deep, but I mean, it was a definite improvement. No fillers. Another patient just had around the mouth. Yeah, she had multiple treatments. And this is the patient, very hard. She had a previous face and neck lift, but it was done elsewhere. And like they did this platysma work, but it was like open. I do it now with my Elevate, which, you know, you can read about, but this is amazing because it bunched everything up under her neck and made a big, you know, pouch. So she didn't want surgery. So I just did the stuff around the whole face and the neck and underneath the jawline. And I was impressed. Yeah, I was very impressed with her result. No surgery. This patient had little tiny little, they're dermatological lesions that, you know, it's hard to get rid of. It's around her eyes and so forth. So this is the only one that's not my patient, but the doctor used the micro pen, which heats, and then he did the CO2 over it, and it worked very, very well. So let's just conclude and say that we can use the high peak power, which is the cool peel. It produces a superficial epidermal and dermal injury with rejuvenating results and minimal downtime. That's the key. And then the radio frequency complements it. It can be used alone, but it basically has no downtime. All right. It spares the epidermis, targets the dermis. Okay. And the depths can be varied. So I can set it like an oven. I can set the temperature, I can set the depth, and I can set the time. So it's very much like, I mean, we're women, we belong in the kitchen. So we belong in the OR too. Patients can achieve a natural appearance with minimal downtime and minimal post-procedure care compared to what I told you I went through years ago. And you can safely combine these with excellent results. And patients are very happy, but they should be repeated because we're losing collagen as we speak. So thank you so much. I am honored to be here. This is a great organization. I have to tell you, I'm always amazed when I see the women that they recruit. They're so strong, and the men. And I want to wish all of you a beautiful Mother's Day. Yeah. Okay.
Thank you.
Thank you so much, Dr. Petti. Okay. So we have about 10 minutes for questions. So we'll go in order. I have in the chat and then in the back. For those online, if you have any questions, please feel free to put them into the chat or unmute yourself and we'll get there as many as we can. So the first question, I have lines above my lip. What is the best way to decrease their appearance?
Well, it really depends on the depth, I mean, I have to see them, but I mean, in general, it's going to be your basics, using Retin-A as far as topical, and then using sunscreen. And then you have options of fillers, fillers. There's some new fillers too that can go really superficial right into the derma. Skinvive is one that has just been released. And I have used it around the lips. I think it's really good because you can get it superficial, very fine needle. It only lasts 6 months. It's kind of like a hydrofacial because it's hyaluronic acid, pulls in water. So, I mean, if you wanted to have for a wedding or, something 6 months, but then otherwise we'll use more of the hyaluronic acids that are a little bit more thicker, that'll last longer. And again, they're more cross-linked. So the more cross-linking the Restylane or the Juvederm is, then the longer it will last. And what's beautiful about those products is they're made in certain textures and cross-linking, so they match like where you're going to put them, like the cheeks or around the mouth. Softer here, harder here, a little harder here, softer, of course, around the eyes, temples. So yeah, that's.
Thank you so much. We had a question in person in the back.
Yeah.
Yeah.
You can elaborate between Botox and the other procedure.
Botox?
Yeah.
Oh,
I'm not familiar with.
Yeah.
I know it's on the market for 7+ years, but maybe you can give us
so Botox is a neurotoxin. And so it's given by injection. It's very safe if you have it in the right hands. I know people won't, some people won't even talk about it, but it's very safe in the right hands. And what it does is it paralyzes the muscle. So this has nothing to do with like muscle. This is what I talked to you about was treating the skin, the epidermis and the dermis, but below that is the muscle. So why does it create wrinkles? Because it just makes your skin buckle, every time you frown. Oh, you look at somebody like her, she's gorgeous and young, and she can keep frowning and she doesn't have a line. But if she kept that up over time, another decade maybe, it would start to show little impressions of like corrugations, right? Like folding, right? So the Botox will paralyze that muscle so you don't move it, so you don't form the line if you start early, or it'll soften the line if you start later and you already have established lines.
Wonderful. We have a couple questions in the chat. The first one is, what do you recommend for the gray appearance skin after cancer treatment?
I don't think I've really dealt with that. I'm going to be honest with you. I don't want to stand here. I'm not a dermatologist, so that's not really my population, but I'd love to learn about that. I don't know I'm not sure what it's from. I don't deal with that, but I'm going to have to look it up. So it's a gray appearance of the skin after
Cancer treatment.
Okay.
Thank you so much for
I'm
your
gonna look
honesty as well.
Yeah.
The next question is, where can we find you? And her website I put into the chat is dr-petti, Petti.com. And the next question, and now go to you.
Yes.
Oh, no, that's what, the next question is price range for the treatments you discussed.
Yes,
And then-
a good question. So the microneedling is $850 per treatment. That's like for the full face. And when everything in my practice, I do. I don't have anyone else doing the treatments. I do them. So you're getting a plastic surgeon. So I try to do depths and passes. There's a number of passes. Like you just don't go over once. Again, if you had areas that, you have more wrinkling, I'm going to go over those more. So, hopefully with someone who is a plastic surgeon or an MD, I think, although the nurses do great work too. I don't want to, it's Nurses Week, happy Nurses Week. But I'm just saying, like, just find somebody who's highly qualified and, their credentials and their results.
That was for the microneedling. What about the CO2?
The CO2, that costs for the cool peel, it costs 1,000 for each area, 1,000 for the face, 1,000 for the neck, 1,000 for the chest. By the way, these can be done on anywhere on the body, both the microneedling and, so we'll go by like how much time and surface area. But when, in my practice, when I combine, like if you're gonna do face and neck, because that's very common, right? We discount the neck, you know, so we give you a little discount, yeah. And then once in a while, we run specials and things like that, yeah.
Thank you. In-person question here.
Yes, I'm cursed with vertical necklines.
Yes.
Will the cool peel do anything, or is this really a surgical thing? Take care of that.
If Dr. Petti, if you don't mind repeating it for the people online.
Yes, so she asked me, she said she's cursed with the vertical necklines. Keyword, cursed. Vertical necklines are usually due to the platysma muscle. So some people, I mean, I don't do it, but some people put Botox in the neck. I don't, because I just won't I'm worried about Botox moving to areas that are vital to survive. So I don't do it. But the other is I do a new procedure. It's fantastic. It's called My Elevate. It's on my website, but I basically do a closed neck lift with platysma, division of the platysma bands. So it lifts the platysma once the bands are divided, but I have a suture, it's a suture rod. It has a suture that's permanent suture, not the thread lift, but it's loaded onto the rod. It's lighted. I can go under the skin. I can lasso the muscle on the right and then the left. We giggly saw it and divide it. And then you have to wear a collar. That's the down thing, is that you have to wear a collar for like 10 days. But I tell patients, you know why? Let's talk about why. It's because I'm dividing the muscles then separate, right? But if you're down, like everybody's like this, like this on their computer. So it'll rejoin, it'll refuse. So you have to kind of keep your neck like this for 10 days. So you can just say, you got bumped from the behind and you have a neck collar on.
So
Yeah.
the other part of my question was big brown patches.
Yeah.
Which of these procedures will work for that?
Well,
sorry, repeating for the question.
Yes, she said big brown patches, she pointed to her face and her chest and, there are various, number one is you want to lighten them. They're never, depends on, pigment's hard to treat. That's probably the hardest thing that we face. Because the pigment can go very deep and there's not treatments that can penetrate safely that deep. So we can use topicals, hydroquinone, retin-A, other, agents, but then we can also use these will lighten. I never promise though. I'll be honest with you. I don't promise. And then we can use intense pulse light, which you can then have multiple wavelengths of light and you try to pick the wavelengths then that target what? Melanin. Yeah.
So retin-A could actually be applied topically to lighten?
Yes. Retin-A is amazing.
Thank you. And for the last question, there was someone in the back that raised their hand early. Okay.
Are you photosensitive, like after, sun sensitive?
Yes, it's
If you could repeat the question.
Oh, she asked, is a patient photosensitive after having laser or microneedling? We tell them to, this is not as strict if you do the cool peel, especially it's a lighter one. They can go out in the sun, but with protection and good sunscreen. There's great sunscreens now, but you're not going to bake. No, I would never say bake in the sun, but you could go in and out. You could go for a walk, but I usually say early morning or evening and then protection with a brim, maybe even a scarf for the cheeks, it depends.
Like a certain amount of time?
They can go out in the sun in like 2 weeks, but they're not to bake, just for daily activities or exercise. Yeah.
Wonderful.
That's reflected light too. So that's difficult. It's a little more difficult. Yeah. We'd have to be careful.
Thank you so much, Dr. Petti, and for everyone for being here with us today.